Do you know 1 in 8 women will be diagnosed with a breast cancer in her lifetime? Now, breast cancer is the most common cancer diagnosed among women worldwide, accounting for 30% of all cancer cases in women. It's also important to note that men can also develop breast cancers, though not nearly as prevalent. And according to the Centers for Disease Control and Prevention, that is the CDC, in the US, there's about 240,000 cases of breast cancers diagnosed in women yearly, while 2,100 cases are diagnosed in men. Now, today I'm going to be talking breast cancers, highlighting important concepts, various types of cancers, the risk factors and symptoms associated with breast cancers, and also the available treatment options. Hi, I'm Dr. Francisca Osage, and thank you for joining me on Francisca on Health Matters. Before talking about the breast cancer terminology, let's appreciate the anatomy of the breast. Now, the internal structure of the breasts are pretty much made of fatty tissue surrounding chambers called lobules. The lobules are where the breast milk are being produced, and these breast milks are channeled through the ducts before being expressed. So pretty much you have the breast tissue consisting fatty tissues surrounding lobules and ducts. The cancer cells are derived from either the lobules or the ducts, and the name given to the cancer is based on where they're derived from. Hence, you have lobular carcinoma denoting cancer cells from the lobules, and you have ductal carcinoma denoting cancer cells from the ducts. Now, in general, breast cancers are categorized as pre-invasive or invasive. The word in situ is used to denote cancers that are pre-invasive. So you have pre-invasive cancers like the ductal carcinoma in situ and the lobular carcinoma in situ. On the other hand, you have the invasive cancers, which are invasive ductal carcinoma and invasive lobular carcinoma. Now, what causes breast cancers? The exact cause for breast cancers are not known. However, there is a link to mutation of genes that regulate the cell cycle. Now, remember, in the cell cycle, there are genes that regulate the process of cell division, and eventually these cells are programmed to die. In cancer, these cells or the genes that regulate this process are mutated, and hence the cell keeps dividing. They don't go on to die when they are supposed to die, and this is pretty much the cancerous process. Now, regarding the risk factors, what are the risk factors associated with developing a breast cancer? We have the age and sex risk factors. As you get older, you are easily predisposed to developing a breast cancer, and being born a female on its own is a risk factor for developing a breast cancer. Now, what are other risk factors? You have the gene mutation, the inherited gene mutation. And what gene are we talking about? We're talking about the BRCA1 or 2 mutation. There is the factor of obesity, exposure to radiation. Also, in postmenopausal women that take hormonal replacement therapy, this also acts as a predisposing factor to the development of breast cancers. Now, taking note of these risk factors are important in staying intentional. There are certain risk factors we can't help control. We can help control getting older or inheriting the BRCA gene. However, with knowledge or awareness of a positive family history of breast cancer, especially developing in a relative at a young age, it might mean subjecting ourselves or having that talk with our primary care that will subject us to screening for the presence of the BRCA gene mutation, which pretty much affects outcome regarding breast cancers. There's also the importance of having a timed and regular self-breast examination and subjecting oneself to mammogram. This is important because breast cancers advance through stages, and the earlier the stage at which the cancer abnormality is picked, the better the outcome. Now, during self-breast examination, we're trying to feel for the presence of a lump. The presence of a lump does not indicate the presence of a cancer. It, however, alerts us to the need to avail ourselves to the healthcare facility in order that further investigations can be carried out. These investigations will include a mammogram, an ultrasound, a biopsy, and this could confirm the presence of a cancer. Now, what are other features that could indicate the presence of a cancer? Like mentioned, there's the emergence of a breast lump. There's also the presence of lump in the armpits. There are skin changes that could occur, such as the presence of rash around the nipple or the areola. There's also changes in the size and shape of the breasts. There's the retraction of the nipple. There's the presence of what we call peau d'orange appearance of the breast, having the appearance of an orange. There's the dimpling of the skin of the breast. There's also the presence of spontaneous discharge from the nipple. So these are manifestations of breast cancers. Now, there are other manifestations such as cough, weight loss, fatigue. Now, these are generally features that accompany cancers. Another important concept is that of staging. Now, for breast cancers, this signifies the size, the location, and the extent of spread. And so you have stages 0 through 4. As the numbers increase, the more the spread, the bigger the size, the more the involvement of surrounding structures, right? Also, the staging also determines the outcome. So for staging of cancers, to know the spread, the extent of spread, we have tests such as CAT scans, PET scans, bone scans are done. And this pretty much determines the management and also the outcome. Another important concept is that of grading. Now, the process of grading helps to determine the nature of the cancer. When a cancer is suspected, a tissue biopsy is obtained. The pathologist then examines the cells of the tissue. The more abnormal the cells look compared to the parent cells, the more grade assigned to the cancer. In other words, the higher the grade assigned to a cancer, the more aggressive the cancer is. Another important concept is that of the cell's receptor sensitivity to the hormones estrogen and progesterone, and another called HER2. Now, these help to determine the best choice of treatment in terms of hormonal therapy or chemotherapy. In terms of the treatment options, there is surgery, radiation therapy, hormonal therapy, chemotherapy, targeted therapy, combination therapy. All of these are going to be based on the discretion of the team, the medical and surgical team involved, and this is going to be also based on an individual level. There are certain factors that are going to be considered, ranging from the extent of spread, the nature of the cancer, the grading of the cancer. Is the cancer responsive to hormones? Are they responsive to targeted therapy? So really much it's the discretion of the experts in this field, the oncologists, the radiologists. However, there's the need to discuss these options and having that informed decision on the best option available. Though breast cancer is still the leading cancer among women worldwide, however, research and scientific advancements have yielded better outcomes in terms of the management of breast cancers. And with more research, there is hope for even better outcomes in terms of its management. Now, I hope you found this informative and educative, and if you've had, please subscribe, and I'll see you in the next one.